Hello and welcome. We're going to wait just a couple of minutes as people are still joining, but thank you for being with us today. Right, hello, everyone. We've still got people coming into the Zoom room with us, so we'll get started in just another minute or two. All right, hello, everyone. Thank you all for joining us today. I'm Ryan Finnigan. I'm the Deputy Director of Research at the Terner Center. And before we get started, I'd like to take a moment to thank our funders who made this webinar possible, as well as our research on interim housing and homelessness more generally. We're going to include their names in the chat, and we're grateful for their generous support of our work. Also, we are going to record today's conversation, and we will make it available on our website in the coming days for folks to refer back to. So today we're talking about interim housing, which is a broad category of programs that provide temporary living accommodations paired with supportive services. Interim housing has expanded significantly in recent years in order to meet the urgent needs of people who are otherwise forced to sleep in tents, in vehicles, or outside each night. But the term interim housing is often used in really different ways, sometimes referring to transitional housing programs that offer multi-year stays and a wide range of supportive services. However, it can also refer to emergency shelters that offer only nightly stays. This variation underscores the need for more evidence on what different interim housing programs do and the policies and resources that are needed for those programs to be effective. In today's webinar, we will preview findings from a new study of interim housing in the Bay Area. The study is being conducted in collaboration with All Home, which works with local governments and housing and service providers to advance regional solutions to homelessness. We've also partnered with interim housing program operators working in different cities and counties across the region, and a diverse group of advisors with lived expertise of homelessness who have guided both the goals of the study and the kinds of data and analysis we've been undertaking. Following a short research presentation, we'll then have a panel of experts that will discuss different priorities for current policymaking and practice regarding interim housing. In the coming weeks, the Terner Center will begin publishing a series of reports that will present the study's full range of findings. The first report will examine how the supply of interim housing has grown across the region, the types of facilities providing interim housing, and the kinds of places where interim housing has grown most. The second report examines the resources needed for programs to operate and serve residents well. And the third report will focus on who is served by interim housing programs, the factors related to moves to permanent housing from those programs, and what residents say is most beneficial or most needed while staying in interim housing. These findings come from several data sources, including administrative data on interim housing programs and residents, as well as qualitative insights from program operators, residents, and a wide range of other stakeholders. The study's advisors with lived expertise have also been crucial contributors, helping to interpret the findings and suggesting new topics for analysis throughout the project. And so I'll just show a few of the findings from these first couple reports. First, we find that interim housing supply has grown substantially in recent years. To measure trends in housing supply, we use data from housing inventory counts through 2024, which was the latest data available at the time of our analysis. And there were about 16,100 interim housing beds in the Bay Area in 2024, which we count as emergency shelter and transitional housing projects. The number of beds increased by about 5,500, or roughly 50% by 2024 relative to 2018. And this trend is similar to that in California as a whole, which saw a 56% increase in the number of interim housing beds in that time. Within the Bay Area, the largest increase was in Alameda County, where the number of beds doubled from 2018 to 2024, and the number of beds grew by around 60% in San Francisco, Santa Clara, and San Mateo counties. This increase was driven primarily by the growing number of beds for adults, which is shown in this yellow area here. In the Bay Area, the number of beds serving adults roughly doubled between 2018 and 2024. It's also important to note, however, that the numbers of interim housing beds fluctuate more than these data can show. So there have been many new interim housing programs that have begun operating since 2024, so the scale of the increase is even larger, while others have closed. So in some places, a growth of supply has also meant more new beds, while some older beds going offline. This increase in interim housing supply has only been possible with resources from all levels of government. Several important state funding programs, such as Home Key and the Homeless Housing Assistance and Prevention Program, have enabled new programs to acquire the capital needed to become established and to operate, while local governments are devoting significant resources, both from their own general funds as well as from dedicated local tax and bond measures. Local governments are also providing land as a crucial resource, and about 40% of beds in the Bay Area are located on government-owned land. It's important to recognize that these investments are yielding safe places to live temporarily for thousands more people each night, rather than being forced to stay outside or in vehicles or in other unhealthy or dangerous places. And that the impact can also be seen at the community level. Recent point-in-time counts of homelessness find that trends in unsheltered homelessness have been leveling off or decreasing in many of the places where interim housing has grown most. And this leads to a common but challenging question, though, which is how much interim housing is needed. And the answer depends on many factors, including the number of people experiencing unsheltered homelessness, how long people stay in interim housing, and the availability of permanent housing, either following or instead of a stay in interim housing. All Home has been advancing a solutions modeling approach, which offers one data-driven way for communities to incorporate these and other factors into their local strategic planning. And we'll provide a link to this approach in the chat for those who are interested. Second, we find that there's been a variety of different types of beds that have come online in recent years. So the growth that we just showed has included new approaches for quickly creating safe and dignified living spaces at scale, and many of which provides congregate or shared sleeping spaces, but many more of them provide non-congregate or private or semi-private sleeping spaces. There's also a share of beds that are provided through motel voucher programs rather than through dedicated facilities. And so most beds are non-congregate, about 62% of them in the Bay Area. And that non-congregate interim housing is more common for families with children than it is for adults without children. So 81% of beds for families with children are non-congregate compared to 56% of beds for families without children. And just to give a sense of what these facilities look like, there's a significant variation even within the same category of congregate or non-congregate. And so pictured here, we have the Mary Isaac Center operated by COTS in Sonoma County, as well as one of the Embarcadero, or I'm sorry, it's the Division Circle Navigation Center in San Francisco, which uses a large sprung tent structure to provide a shared sleeping space. Among non-congregate facilities, there's also a wide range of types of facilities. And so pictured here is a converted multifamily apartment building that operates interim housing for families with children in San Jose County, or in San Jose. We've got a converted hotel, which is the Delta Landing, operated by Bax in Contra Costa County. We have the tiny house site that is operated by Oakland, one of their community cabin site. and the Cherry Avenue Interim Housing Facility operated by Dignity Moves and Home First in San Jose. And so both of these sets of projects illustrate the range of strategies being used to create new interim housing quickly, but also why it can be sometimes challenging to understand what interim housing means when using just a simple broad category. The last few findings that I'll share today are that substantial resources are needed for program staffing and services, meaning that when creating and sustaining new interim housing programs, policymakers at all levels of government and practitioners must affirm to a commitment for those programs to operate well and in a predictable fashion. So to estimate these costs, what we did was review budgets and expenditures with the study's service provider partners. And then we also reviewed local government contracts for several additional programs, aiming to gather data from both non-congregate and congregate programs, large and small programs as measured by the numbers of beds, and programs from as wide a range as possible of the cities and counties within the Bay Area. And so we gathered data from a sample of 37 programs that are focused on serving adults. And what we found was that the average contracted annual operating cost was about $35,000 per bed per year. These costs vary considerably, however, ranging from about $20,000 per bed to about $65,000 per bed. We further found that costs largely reflect the funding available and that the funding available is what shapes program service provision and staffing. Personnel account for most of the operating cost for almost all of the programs in our sample. And when we look at the sample as a whole, personnel costs are about 62% of total operating costs. We further find that in the average of the sample, these programs employ about 2.8 staff members for every 10 beds, and roughly 3/4 of these staff positions are client-serving positions, meaning that most staff have positions like case managers or resident service coordinators, and a minority of staff have positions doing maintenance, property management, or providing security. And so when we interviewed program operators, what we learned was that there is always a need for more client-facing staff. And what they would really want to prioritize if given more resources were staff with advanced certifications, skills, and licenses for providing sophisticated and hands-on levels of care. And so as one program operator put it, quote, "I really want people to have a trauma-informed positive experience while they're staying with us." And there's a lot of work needed to do that. And so the examples of things that providers highlighted as successes were bringing in new resources to their programs to hire licensed clinical social workers or to bring on-site dental care, physical health care, and behavioral health care services. And so in programs with limited funding, these were often highlighted as a bigger gap and as a priority for securing more resources to serve their residents going forward. Looking ahead, we are still in the process of understanding the range of resident experiences and housing-related outcomes for those who are staying in interim housing. We're also examining how interim housing fits within the larger ecosystem of housing and other social service supports intended to resolve homelessness. Interim housing alone is not sufficient to solve the problem. For interim housing to be as effective as possible, there also needs to be available and affordable homes for interim housing residents to move to. And ideally, many won't have to stay in interim housing for extended periods at all. As one program operator put it, quote, "Because there's no permanent housing, everybody's kind of clogged. And so everyone in our shelter system is stuck. There's no more people coming from the street into shelter because shelters are full. And shelters are full because there's no place for you to get housed." And so we're continuing to look at what the key factors are for people moving from interim to permanent housing, and for doing so quickly in a way that enables other people in need to move into the interim housing beds that have just been vacated. We're also keeping an eye toward potential inequities in who moves into permanent housing, what kind of permanent housing, and how stably they're able to stay there. Perspectives from interim housing residents and lived experts are also essential for highlighting the programs that preserve dignity and inclusion and support well-being while on the path to permanent housing. And finally, I'll note that the landscape of resources to address homelessness is in flux. While the state and many local governments are grappling with budget deficits, the federal government is significantly reallocating homelessness funding through the Continuum of Care program, moving funds away from permanent housing and toward interim housing or transitional housing programs. Continuums of care, different levels of government, and housing and service providers are being forced to make many challenging decisions in response to those changes, which we aim to support with the relevant evidence on interim housing programs, resource needs, and outcomes. If more funding is going to be moved toward interim housing, evidence is needed to guide those investments to be as impactful as possible. With that, I'll conclude the research presentation. Please feel free to put any questions that you might have within the Q&A box, and we'll try our best to answer them. And we'll now turn to our panel discussion. So I'm thrilled to introduce David Amaral, who is going to be moderating it. David Amaral is the Director of Research and Evaluation at All Home, where he leads the research and technical assistance projects that further the organization's goals of reducing homelessness and disrupting cycles of poverty in the Bay Area. Thank you for being here with us today, David, and please take it away.
Great. Thank you, Ryan. I'm really looking forward to talking about this important new research and the topic with our great panel of experts. So let's start with some introductions. Chris Cabral is the CEO of Committee on the Shelterless, or COTS, serving Sonoma County. Chris is a U.S. military veteran with over 15 years experience in affordable housing, homelessness, and behavioral health services. Jose Carrizales is a lived expert advisor to the Terner Center's study of interim housing programs in the Bay Area. Jose's decades of experience include professional work in homelessness services and advocacy for people experiencing homelessness in Solano County. Jody Ketcheside is Assistant Director of Supportive Housing for Santa Clara County Housing Authority. She has over 20 years experience working in permanent, transitional, and interim housing for people experiencing homelessness in both rural and urban communities. She has dedicated her career to improving the experiences of those accessing housing services in the communities she has worked. And Kirill Noon is the CEO of Hamilton Families, the leading nonprofit service provider for families experiencing homelessness in the San Francisco Bay Area. As someone who grew up in public housing and who was raised by a single working mother, he brings a personal commitment to Hamilton Families' work. Thank you each so much for making time to be part of this discussion today. I'm really excited to get this conversation going. So let's start with this. Each of you has extensive experience working in a wide range of programs to both prevent and to resolve homelessness. And I'm really interested to hear in your experience what interim housing is best suited to accomplish. Kirill, why don't we start with you on this?
Thank you. Thanks, David, for the question. Certainly, Hamilton Families, we operate a range of interim housing opportunities. We have an emergency family shelter, which houses 70 families a night, and families can stay with us from anywhere from 3 to 6 months in that facility. And we also operate a transitional housing site, which is only 20 units, but families can stay with us for 12 to 18 months. So it's a longer stretch of time. And from my experience, I think the best interim housing is best suited to provide a place of respite. You know, people don't talk about it a lot, but living in poverty is stressful, it's exhausting, and it's hard. And I think transitional housing is probably the best example where families get a chance to take a break, to sit down, reassess their opportunities, look at their goals and their priorities, and really just kind of look at where they want their family to go forward. It also provides an opportunity for a low stakes experiment in practicing the things and skills that they need to be successful in independent living, right? So it's kind of like life training for independent living. It's an opportunity for folks to, do their laundry regularly, cook for their children regularly, figure out how to pay their bills regularly, do all those things. And, in an environment in which, there aren't any huge consequences if they don't do them very well. It's a place for them to sort of learn and practice those skills. I think the other thing I'll say about it is that, there are several keys to success for interim housing. And I think one of them is the proper length of time in the program. Like, give people enough time to sort of take that break, take that respite, take stock of their strengths and figure out what the deficiencies are and figure out how to meet those needs. I think also folks also need case management and wraparound services to help them to support them while they're in that journey. Um, and I think there's also an opportunity for folks to really interact with other programs that provide other services that we don't provide. So, for example, we have folks in substance use recovery here who are working with a therapist they were running their own group on site, which was fantastic. And we have case managers who refer folks to other programs that will support the families in other ways with other things that they might need. It's useful. It is really useful. It changes the trajectory for the families who get to have the opportunity to stay in a space that long for 12 to 18 months.
Great. Thanks, Kirill. The rest of the panel, any other thoughts on what interim housing programs are best suited to do? And Kirill got into this too. I'm interested, especially if you have any thoughts on how interim housing can best work in conjunction with other programs like either outreach or permanent housing programs.
I'll pop in. Yeah, I think that I'll agree with Curiel. It's an opportunity for folks to kind of escape that like survival mode that they're experiencing on the streets and kind of like make some decisions about what they want to see happen, and get tapped into the community and access resources that they maybe didn't know existed. And kind of get a second to catch up on, the important things like health, access to health care, and various resources like that. So, and then I also think it's a really good opportunity for housing navigation, right? Like you have folks are in one place, you don't have to go out and find them in order to help them navigate housing resources. So I think that the focus should be on permanent housing and helping them resolve that.
Great. Thanks, Jody.
If
Chris,
I
did
may,
you? Oh, go
if
ahead,
I may,
Jose.
David, thank you for I'm sorry if I stepped on somebody's toes there, but I think what I found, whether it's interim housing or supportive housing or any type of housing, my unsheltered friends are moved from a stressful environment to a less stressful environment. And from the mentality point of view, my unsheltered friends get to relax, get to calm down, get to understand that a life is much more better with the roof over their head as opposed to a car or an RV, although sometimes that's the only way to live. However, I think the people are able to regain their mentality, regain their consciousness, which helps them accept more services, more opportunities, and advance to a path forward. So I think any type of housing, interim housing, or any other is just a tremendous step forward and helps move forward.
Yeah. Thanks, Jose. Chris, I saw you maybe about to jump in. Did you want to add to this?
I was going to jump in just for a second, just to mention that in my experience, and probably a lot of other people's experience, communities are a lot more successful when they encourage providers to work together. They really, really encourage providers to work together to serve this population, to develop workflows, and to best understand which providers provide services in the best way, right? One provider is not going to be good at every single thing. And the better workflows you have and the more partnerships you have between providers within a community, the less you have to shuffle people around, right? And that is really, really important for the work that we're doing. So I just wanted to add that in there, that communities should definitely be encouraging providers to create those partnerships and those workflows.
Yeah, that's a great point. Thanks, Chris. Okay, I want to move on to a question about how to approach developing and operating interim housing. So there are many different types of interim housing, and even within a particular type, individual sites can look very differently. For example, two tiny house sites may look and feel very different from one another. And the same is true for two congregate sites. And so I'm interested to hear from your experience, what are the key ingredients for making an interim housing program safe and dignified? And Jose, I'd love to start with you on this question.
Thank you. Thank you for that question. That is an interesting and a very important question that is important, that is vitally important to my unsheltered friends. And I remind myself, that question reminds me of a study that I read in Des Moines, where my friends, my unsheltered friends, chose not to participate in a shelter only because they possibly felt a sense of unsafe. And so that is a barrier to wanting to be in a shelter or wanting to be in housing. It is important for my unsheltered friends to have a sense of safety, obviously, have a sense of empathy in the place that they're going to stay, because there may be somebody there in that area or in that facility who they may know outside, and they don't want to be a part of that. And it's difficult sometimes here in my area that for policymakers to understand that point. Safety and security is an absolute important element. My unsheltered friends are deal with the in an environment where they are unsafe and they are harmed in many ways, and they have to have a sense of trust. Who do they going to trust when they go to a facility or when they want to be a part of a facility? So the collaboration, the build a rapport, build a sense of a community. I like that word. I like that phrase. I like that word, community. My unsheltered friends are human beings, and we all want to be safe in our environment. And safety and security is an absolute important element uh, that involves the mind, the ability to help them move forward in their lives. They want to be safe in what they're doing, and they want to be secure in their possessions and in their mind and body. So, absolutely, safety and security is an absolute important element to helping my unsheltered friends move forward in their lives.
Yeah, thank you, Jose. I'm really interested also to hear from the rest of the panel, and especially from a service provider's perspective. What are the things that go into cultivating the sense of trust and safety and security?
Yeah, to build on Jose's comments here, I think the question reminds me about going back to the basics, right? You have to have a building that is maintained properly, that is safe and secure. You might need security guards at the building to provide that sense of safety and security. You want to make sure that everything works. You know, for example, one of our shelter is owned by the city, and we don't own it. And so when large maintenance projects have to happen, we have to call on the city to come fix things. And sometimes they do that quickly, sometimes not so quickly. And, you know, building a strong relationship with the city to help move these projects along is really important. So, I mean, it really is about providing, you know, really basic needs, including staffing levels. I think Jose talks about building trust. You can't do that without proper staff. You have to have staff who are trained, who are empathetic, staff who you're paying well enough. They will retain. You can retain them in their positions and provide a sense of consistency across over time. I mean, it really is about, you know, the families who do best in our program are the ones who build rapport very quickly with their case managers and with the staff, and, you know, help and avail themselves of resources that are out there. So yeah, I think it really is about, you know, really sort of strengthening the basics that you have, your facilities and the staff.
I'll pop in. Um, I think one of the the biggest issues I've seen over the years is that interim housing projects are concentrated to a certain part of town, but everybody kind of has their own part of town, their community, their, you know, where they know people, where they might have people that have helped them with meals or showers or just family members that they tend to want to stay near. And so I think that in addition to having a variety of models that, folks can access and having some choice in accessing those models, having interim housing projects kind of spread over across communities, counties, cities, makes a lot of sense because, we all have places, parts of town that we prefer over others or that we feel safer over others, and expecting everyone to conform to wherever those projects are plopped down, whatever part of typically downtown, right? Um, it's not fair. It's not super humane. And we have to start thinking about people as part of our community, right? Like they're all our neighbors and they all live here and they should have some choice and some autonomy in what types of projects they access and whether or not it's important to them to have their own bathroom. Whether congregate works for them. I had a lady that said something to me once that I'm gonna share. She said, I can't live in an apartment complex because I'm schizophrenic, and when I hear the neighbors, it sets things off for me. And I can't tell what's real and what isn't. And that stuck with me. And so her housing plan included, the lease of a mobile home on somebody, on a piece of property that was rented out. Um, so that she could be someplace where she wasn't hearing the neighbors. So I think we have to think of things in that context that like something different is going to work for everybody. So having multiple types of models is really important over, in various parts of town.
Yeah. Thanks, Jody. Chris, go ahead.
Yeah, for what it's worth, just a couple of things that have been really helpful. So we have congregate and non-congregate settings. And in our large congregate settings, something as simple as like quality sound panels throughout the facility, and then movable panels that separate bunks into like quads of four so that people feel like they have a bit more privacy and the sound isn't overwhelming. Those kinds of small things, to Curiel's point, in maintaining your facility and making it feel welcoming and a little bit more private and a little bit more like home, have been really helpful. And I think all of this, everything that everyone said is true. And a lot of it goes back to having the right leadership at these organizations that really prioritize the vision um, of quality service and quality reputation with partners, with the community, making sure that staff understand when they make a decision that it should be in the best interest of the client that they're serving and of the community more broadly. And that is something that you have to do as a leader in these organizations all the time, is make sure that staff understand what they need to be thinking about when they make decisions, both in kind of crisis mode and when they're in a case conferencing session, right? So communities need to make sure that they're engaging with leaders of these organizations who are providing these services so everybody can maintain kind of a consistent vision of high quality services throughout the system of care.
Yeah. Thanks, Chris. And I think, oh, Jose, do you want to add to this?
I thank you, David. I just wanted to commend my fellow colleagues in your comments. I could have spent 3, 4 days discussing this, but it's important that that everybody know and understand the unique needs and wants of my unsheltered friends. And my colleagues have accurately and succinctly described the issues, the situations, and I support your words and your thoughts. And I am very thankful that there's a sense of caring and empathy and passion in the general public that understand, as I said, the unique needs and wants of my unsheltered friends. That's how progress is made. Is the first step to understanding. The first step to helping is to understand. And when there's a greater sense of understanding, there will be a greater sense of helping. And I appreciate the words that my colleagues made this morning. Thank you so much.
Yeah. Well said, Jose. I share that appreciation. And I think this is leading into the next question I have for the panel. Our study found that many interim housing programs are working to provide similar kinds of support, but they're doing so in different ways, partly due to differences in the resources they have available, and partly due to differences in people's particular wants and needs. And so I'm interested to hear how you think about tailoring the services that interim housing programs provide to meet the participants' particular situations. Jody, I'd love to start with you on this.
Sure. Um, I think it starts with talking to the people you're serving, right? Like find out what they need, what they want, um, and let them make those decisions. I think that historically we spend a lot of time doing services to people instead of with people, right? Like, and so I think that flexibility is huge. You've got to be able to pivot. Somebody needs something that you hadn't thought of, you got to go out and find it. And getting locked in to, this is what we've always done in the past. It's ever evolving, right? So your services have got to be able to be tailored to everyone's individual need. Is that easy? No, it's super hard. But flexibility is key and creativity and thinking outside that box, right? And going out and finding it. And if you can't find it, maybe you can encourage somebody to make it.
Great.
Yeah.
Thanks, Jody.
I agree 100%, Jody. I think one of the things that one of the ways that we try to address this question is by hiring staff who have lived experience, like folks who are members of the communities that we serve, so that when participants do show up, they see people who look like them, who sound like them, who have had experiences like them, and who understand with their gut, like in a really visceral way, what is it they're experiencing. And so when they ask for something, they're not looked at like they're crazy. They're like, oh, I get that. Sure. Let me figure out how we can help you get what it is that you think that you're telling us that you need right now. So I think that that sort of recruiting and retaining staff who have lived experience is a key component for us. And yeah, and that's really been helpful in helping us meet the needs of our families where they are.
I must also agree with the idea and concept, and those who know me here in Solano County for the last 12 plus years, I've always talked about incorporating those with lived experience and lived expertise. I think there is a difference, a strong difference between lived experience and lived expertise. And that is important, just like my young friend said, to have a sense of trust because I've been there, done that. I know when I go out in the community here in Vallejo and and I go to the encampments, since I was homeless for 2 years in the JFK library, near in around the JFK library, I have a sense of understanding. I know what it's like at night. I know what it's like not to eat for 3 days. I know what it's not like not to shower for a week. I know what it's like to almost engage in fights. And I can build that rapport. And that's an important element for lived expertise involvement in this issue. It is vitally, vitally important. And I certainly agree with my young friend, the young lady who spoke with her, who made her comments. Tailor the individual needs and wants to the person who you're talking to. Everybody has a different life experience. I'm a family of 8. Some may be a family of 3. Some may be a family of 1, just by themselves. And when you have that sense of understanding, the first step to helping is to understand, and that's my mantra. I'll put it on my tombstone. You've got to understand the situations in order to help people, and I could. It's vitally important.
Yeah,
Um,
I
thank you.
appreciate I appreciate that, Jose, and I actually want to build on that and send another question back to you. And it because we've been talking about thinking about how interim housing programs can meet the needs of whoever shows up. But I also want to dig into who is being referred and connected to individual interim housing sites. And so although interim housing programs are scaling up, we know there are many more people experiencing homelessness at any time than there are beds. And so I'm interested to hear what you see as the key priorities for ensuring that access to interim housing is equitable and has the fewest possible barriers. Jose, what do you think?
That's a great question. Thank you. And it's a very simple answer. It's just helping people match people to the type of shelter that they're seeking or that is appropriate for that person. And an elderly person stays in an elderly shelter, and along with that, women stay with women and children, and along with that, there's the barrier of documentation. Must have documentation, and these facilities require uh, within the last 90 days or some 30 days, but mostly 90 days of accurate on-time documentation. On time is not the right word, but I think you guys know what I mean. Um, it is. I don't mean to laugh at the question, but it is a very simple idea that is just to help my unsheltered friends. It is just important to find what they need, reduce that barrier, and as my young friend said, just tailor the needs to to those individuals. I'm gonna cut off my camera, my sound real quick.
Sure. Thanks, Jose. Yeah, and for the rest of the panel, other thoughts on how interim housing how we can ensure access to interim housing can be equitable and we can reduce the barriers to entry?
Yeah, I think strong, well-developed, sophisticated, coordinated entry systems are important for communities, really, really critically important for communities, not just for helping ensure equity, but also for ensuring the data that's coming through is accurate and timely. Um, and I also think one of the barriers we haven't really talked about today is funding, right? So some of these both congregate and non-congregate sites are funded by multiple funding sources that prioritize this demographic over that demographic. And so in those cases, sometimes providers must prioritize demographic A over demographic B because of the funding that they need to bring in the doors simply to maintain operations. If there were more flexible funding available and the funding was actually enough to pay for these sites in full without having to braid 15, 20 different funding sources, that would open a lot of doors and allow for greater equity and flexibility. And it would certainly reduce the administrative time necessary for maintaining waiting lists at a lot of these larger projects.
Chris's point, I would add, for us, it has been really crucial to be in conversation with the city, which provides most of the resources for us to provide the services that we provide. And so, for example, a year or two ago, there was a coordinated entry work group that was really working on trying to solve some of the challenges that providers had identified with coordinated entry as a system here in San Francisco. And so we were allowed to sit at the table and have a voice and work with the city on how to smooth out some of the bumps and some of the problems that we were seeing with the coordinated entry system to try to make it better, more equitable, easier to navigate, et cetera, et cetera. So I feel like having some kind of relationship with your funding source is really important as well, so that you can speak to it at its base, right? Like if the coordinated entry system is being mandated by the city and county, then talk to the city and county about how to roll it out. How can we help change the way it's being rolled out in ways that are more positive and beneficial for to the communities that we're serving?
I think also, just to kind of bounce off of what Chris was saying in terms of flexible funding. So, being that interim housing isn't the end goal, right? Permanent housing is the end goal for most people, maybe not all, but most are looking for someplace to call home. And I think that we lack sometimes the creativity to push for budget line items in our funding that will cover things like car registration. Um, any sort of back fees for late registration. Part of the responsibility for interim housing is to prepare folks to be able to go move into wherever they're going, right? Well, apartment complexes have rules in terms of what your car has to have in order to be able to park it on site. And so we have folks that are losing their vehicles. They're being towed because there isn't that flexible funding to cover things like that. And the last thing we should be doing is taking people's cars, right? Especially since that's a lot of people's backup plans. But there's a lot of things like that we could help resolve for people so that they're prepared to be successful wherever they're going after they leave interim housing. And so I think like getting creative when we're getting a new funding source and plugging those line items into the budget and then arguing for the importance of them and fighting for those flexible funds is important.
Yeah. Thanks, Jody. And actually by calling interim housing into the context of permanent housing and the ultimate goal, you've done a great job of setting up the last question I have before bringing in some audience questions. And uh, it is this: the availability of permanent homes is a key determinant for interim housing residents' outcomes. And so I'm interested to hear when affordable homes are available. Uh, what are the resources and strategies that interim housing providers can leverage to facilitate those moves? Love to start with you, Chris, if we could.
Sure. Yeah, I mean, I think some of that's going to vary community by community. Sonoma County is, compared to other Bay Area counties, pretty rural, pretty small budget. So we're going to have fewer resources than we can draw from locally to support that process. But certainly, the implementation of Medi-Cal's CalAIM enhanced care management and the various community supports, the housing trio, the new transitional rent benefit, all of these things can absolutely be leveraged once somebody locates permanent housing, and they can be leveraged to fill gaps in interim housing as well. You can pair things like transitional rent with the Behavioral Health Services Act, housing and intervention subsidies on the back end. So there's a lot of different ways that you can braid and blend CalAIM, ECM, and community supports funding to support folks as they move into permanent housing, including housing subsidies and the provision of supportive services. So I think that's really important. And again, every single county, unfortunately, does CalAIM differently based on the managed care plan that you're working with. Some are easier than others. Shout out to Partnership, they're great. I do hope that other providers are kind of either already fully integrating CalAIM services or really diving into it as we see kind of this flux in state and federal funding. That is probably the primary resource, if I'm talking about something that's applicable across the Bay Area, that I would encourage providers to either fully utilize or look into how you can partner with somebody that can help you utilize that resource.
Great. Thanks, Chris. Other thoughts from the panel on what interim housing can really do to facilitate those connections to permanent housing when it is available?
I think back to like I think in addition to having a CalAIM, whether you're the CalAIM provider or you're linked up with somebody, even getting back to basics, like everyone who comes in is told about the Housing Authority's interest list, is assisted with that application. Folks are notified when that list opens if it's not a list that's always open. Um, Staying in the know on that, on your community's affordable housing um, listings so that case managers can notify folks that stuff is available, that there's housing options out there. I think that getting too locked into coordinated entry being the only option for housing is kind of what's creating a bottleneck, right? You gotta help people, again, outside the box, right? Look for other options, apply for general affordable, all of those things.
if I may jump in real quick, David, one of my other favorite sayings is housing with wraparound supports will end homelessness. And I think with all these, as Chris was mentioning, all these programs without housing, these programs may not be a benefit to many people, although it's a helpful temporarily and momentarily. Housing is the absolute final, whatever type of housing, is the absolute final need, strongest need. And those who know me in here in Vallejo, Solano County, I promote as much as I can with all the policymakers who will willing to listen, that the building of housing, affordable housing, the building of housing is vital in making a dent in the unsheltered issue. And all these programs exist. All this most There's a lot of safety nets, but the one piece to this puzzle is housing. And I hope policymakers will figure out a way to build a much more inventory, a much greater inventory of housing.
Just
Thank
really
you.
Thanks so much, Jose. Just really quick, one thing I did not mention, I would so highly encourage providers here or other community members, stakeholders, whoever you are that's interested in this world, engage with your county in the development and implementation of your Behavioral Health Services Act integrated plan. There is so much flexibility in that funding, but not every community is using it in the same way. For example, BHSA can be used to support storage costs and moving costs and landlord mitigation funds and landlord outreach, not to mention, ongoing housing subsidies. So if you're a provider or another stakeholder that's interested in how you can help facilitate moves from interim housing to permanent housing, that BHSA integrated plan can be a really key resource in helping you develop some guidance around that. And that's all brand new for everybody. So get in early, and get your foot in the door and see if you can help your communities develop flexible ways to move people from interim to permanent housing. Highly recommend.
Yeah, great point, Chris. I want to make sure we have some time to get to some of the audience questions. We have a great collection of questions, more than we will have time to address, unfortunately. But one relates to something you brought up, Chris, around partnerships between providers and the importance there. And there's a question around whether there is a formal, perhaps county facilitated structure for encouraging providers to coordinate workflows so that case management is connected to interim housing programs to permanent housing. Or is collaboration more informal or relationship driven? Would love to hear your thoughts on how providers are collaborating and perhaps what could improve that collaboration among providers.
That's a great question. So here, a lot of it has historically been driven by the providers themselves, but that is quickly changing, right? As the funding landscape changes and the sophistication level of providers, public officials continues to increase, we're doing a lot to, I wouldn't say force partnerships, but kind of force partnerships, right? As we chase things like encampment resolution funding, we've already identified the key players who are good at this and this and this, right? I know our organization is not good at outreach. We don't want to do outreach, but outreach is critical to filling the beds that we have. So we maintain really strong partnerships with the outreach teams, and we support their applications for funding. And we meet every so often to develop workflows or refine our workflows. And we also keep public officials and public partners up to speed with what it is that we're doing. And it is a constant thing that you have to focus on. And it's just, I guess as the CEO, it's just part of my job to make sure all of those pieces fit together.
Yeah.
Any other thoughts, real quick, Kirill, on
Yeah, I mean,
collaboration?
I would say here in San Francisco, we have a couple of organizations that provide a forum for those opportunities for collaboration. We have, for example, we are part of the Homeless Emergency Service Providers Association, which has been around for 20, 25 years. And it's really all of us who provide services to this population having a conversation on a monthly basis about what needs to happen next, who needs to be partnered with who to provide what. And it really does help build the kinds of relationships between organizations that facilitate that kind of collaborative process. And so having those kind of sort of professional forums to do that has been really helpful to facilitate that kind of collaboration that we're talking about here.
Yeah, great. I want to make sure we get to at least one more question from the audience. And this is one of those sort of, I don't know if I'll say lightning rod, but it's a prominent question, and it's around the current time that people spend in interim housing. The question comes from somebody who had a family member who was in an interim housing site for for about a year before moving into permanent housing. And they're wondering what's actually driving the length of time that people stay in interim housing before they're moving into permanent housing. Is it purely the availability of the permanent housing, whether it's vouchers or new units, or is there anything else at play? Uh, Jody, do you want to take a first stab at this?
Yeah, I think availability has a lot to do with it. I think also um, a lot of times folks through coordinated entry. I love coordinated entry. I think it's a really great thing. I think that it can stand, to be improved ongoing. Um, but I do know I've heard a lot of stories from people in interim housing that they get, matched to rapid rehousing, and they know that given their social security allocation or whatever their income situation is or their age, that that's not sustainable for them. And so I think we do actually see a lot of people that have to kind of go back to the drawing board on a housing plan once they're matched to something. Um, and then I also think like just availability and the cost, right? How many units, what's the turnover like in any given community, specifically the Bay Area? Housing costs are crazy expensive. So I think all of that really does contribute. And then getting right back to the bare bones of it is that are folks ready? Like, is that what they want? Is that their plan? We talk about like oftentimes there's a lot of interventions that happen before someone goes, yeah, okay, I'm ready to be inside permanently, right? Like sometimes they'll visit a shelter 6 or 7 times before that feels like a good plan for them, and we have to allow for that. We're working with adults here, like they get to make decisions just like we do. So.
I just pop in really quickly. One of the other things I'll say about this is that part of what happens when folks are in interim housing here at Hamilton Families is they're working on barriers. A lot of our families have poor credit histories and really working to resolve some of their previous debt. They also have evictions on their record that we try to help them expunge and kind of sort out. And so there are some really practical things that happen while people are in interim housing that keep them from being housed as quickly as they might otherwise. I mean, obviously availability is a big issue, but once some housing is available, if you have, bad credit, a landlord is not likely to rent to you. So we work to help our families resolve some of those kind of really practical nitty-gritty issues that will be a barrier to housing while they're in interim housing with us.
Yeah. Thanks, Kirill. And Jose, we're coming up on the hour, but I think you want to get in here. Why don't you finish this
Just,
question?
just real quick, I just want to commend my colleagues on having a sense of understanding. The expressed points were on point and very true. It's just about the readiness of the people or the person. Are they ready to move forward, or do they need more time to relax and have a good sense of their environment and understanding that they need to fix themselves, quote unquote. Thank you, David.
Yeah, thank you, Jose. I appreciate that. It is time for us to wrap up, but many thanks to each of our participants today for your insights. Chris, Jose, Jody, Kirill, we really appreciate all of the experience and perspective you've brought. And thank you to everyone for tuning in, and have a great rest of your day.